Usain Bolt is the fastest man in the world. He won the 100-meter and 200-meter dashes in the 2008 and 2012 Olympic Games. However, this high-esteemed runner is not without setbacks. In 2010, Usain Bolt suffered from Achilles tendonitis. According to the home of World Athletics, Usain Bolt said the following about his injury. "I developed a stiffness in my Achilles tendon last week and sought medical consultation. After careful consultation with Dr. Hans Müller at his clinic in Munich, I have been advised to take a 2 to 3 week break as a precautionary measure to avoid risking further damage." A runner shouldn't run through pain. Because first, a runner should pay attention to their body. Second, an injured runner should seek help. And third, a runner should take a break or get a break. Usain Bolt followed the first step perfectly. When he first noticed he had pain in his Achilles tendon, he acted on that pain. The Big 7 Body Breakdowns, an article from Runner's World, wrote on many injuries that runners face. Some of these injuries included runner's knee, Achilles tendonitis, and stress fractures. It is very important for a runner to know the symptoms of these injuries, to diagnose them early, and so that they can get better faster. If a runner is experiencing pain under their patella, it may be that they have runner's knee. If they have pain in the back of the heel, it may be runner's tendonitis. And if it is pain in a specific part of the bone that increases with exercise, it may be that they have a stress fracture. Once a runner realizes that they have one of these injuries, an immediate reduction in workouts is important. If a runner does not reduce their workouts, then the injuries may just get worse. Team Oregon Running Tips published an article titled "Early Detection and Treatment of Running Injuries," where it writes that many injuries are caused because runners ignore the pain, and they just push through it. Instead, once a runner notices they have pain, they should ice the area, compress, elevate, and massage. And if that does not make the injury go away, then complete rest may be called for. These running injuries are so common. That is why it is so important for runners to stop them early. Once an injury is detected, it is important for them to reduce their workouts so they will be able to heal faster. A runner should pay attention to their body. Once they figure out they have an injury, a runner should then seek help. My second step, an injured runner should seek help. A medically reviewed article from Everyday Health writes on the topic of whether a runner should seek a doctor's care for an injury. The answer to this question is simple. It simply depends on the type of pain that they are experiencing. If it hurts too much to walk on an injury, then a runner should not decide to do a workout and hurt the injury more. Robert Gottland, a DO, said the following: "You should see a doctor when the knee is running your life, instead of you running the knee's life." If a runner is having a knee injury and is not getting better, it could be the result of torn muscle or cartilage, in which case help from a physician is needed in order for it to get better. The American Academy of Orthopedic Surgeons published an article about the common running injury, Achilles tendonitis. This running injury is very important to seek medical attention for, because if a runner continues their workouts, then this tendon may even rupture, which will cause the healing process to take way longer. A doctor may call for an X-ray or an MRI to find what is exactly responsible for causing the injury a runner is facing. And once the doctor figures out what is causing the pain, they will tell you the right way to treat it, whether it be surgery, physical therapy, or simply rest. Seeing a physician is the best way to get on the road to recovery. If the first two steps are very important in the healing process, but if the third step is not heeded, then a runner may never get back to the sport. My third point, a runner should take a break or get a break. The academic and peer-reviewed Journal of Orthopedic and Sports Physical Therapy wrote an article on bone stress in runners. Running is a very beneficial activity, yet it can cause lots of stress on the bones. Bone stress first starts with stress reactions. Then it precedes stress fractures. And if this is not taken care of, then it can result in a full bone fracture. So this injury can go from taking 6 weeks to heal to, after it being fractured, can take up to 6 months or more. Runner's World published an article in 2014 that was reviewed by Jeffrey Brown, the doctor of psychology. This article talked about how time off is very necessary in the healing process of a running injury. Runners need to take breaks in order to heal, because this will increase their ability to enjoy the sport in the future. Runners must take breaks in order to heal from their injuries and to prevent others from happening. A runner needs to take a break or get a break. Running is a very beneficial sport, yet it can cause many injuries. Usain Bolt handled his injury very well when he listened to his body, sought help, and then he took a break. Long-distance runners tend to ignore the pain and try to tough it out and keep going through it. But that is not the right way to go, because in the future, it may ruin their chances of enjoying the sport. Next time you're on your morning run and you feel sharp pain, instead of pressing on and just enduring it, you should stop and see what is causing the pain and act on it. First, a runner should pay attention to their body. Second, an injured runner should seek help. And third, a runner should take a break or get a break. A runner shouldn't run through pain.